Good evening. My name is Ugo. I am a student at University of Massachusetts Global. Today I'm going to be conducting a full body assessment on a client by name Bessie. I've already obtained a consent to have this procedure done. And Bessie, if at any time you don't feel comfortable or you feel any kind of discomfort during this procedure, please let me know. Are you giving us a go ahead order to continue with this proceeding? Awesome. Bessie, can you tell me a little bit of yourself and why are you here?
I'm 18 years old. I'm at University of Maryland, and I just get a job, so I require physical.
Oh, okay. So you need a physical.
Yeah.
Which is a job, which is one of the requirements for your hire. Okay. Do you have any medical problem that we should know?
No, I don't. But my dad has high blood pressure. My mom doesn't have anything, and both of my parents, well, my granddads died of stroke, and my grandmas are still alive, and they don't have anything.
Okay. How is your diet? How is your nutrition?
It's good. I usually eat unsweetened yogurt in the morning, and then for lunch I eat a sandwich with wheat bread, and then for dinner I have whole grains with chicken and veggies.
Okay, awesome. You look like you're keeping up with a good nutrition status. How many times are you active?
Yeah, I do a workout lightly 4 to 5 days a week.
Okay. Do you smoke?
No.
Okay. Do you drink?
No.
Okay. Do you take any recreational medication?
No.
Okay. Are you sexually active?
No.
Okay. When was your last period?
2 weeks ago.
Okay. When did you have your period? When did you start having your period? At what age?
11.
Okay. All right. So no sexually transmitted disease.
No.
Have you had your pap smear?
No, not yet.
Not yet. Okay. All right. So we are going to continue. I'm gonna start from the head to toe. So I'm gonna start with your hair. Okay. Your hair. I just want you to know that I wash my hand and sanitize it before I come here. Your hair is coarse, it's evenly distributed. There's no rashes, there's no lesion on your scalp when I felt it. And your hair is evenly distributed. Okay? And then I'm looking at your nail, well shaped, good contour, no clubbing. Okay? No rashes, no wound. Okay, and then I'm looking at your face. Okay, I want you to clench your teeth for me. Okay, I want you to close your eyes and squeeze it. Okay, frown your face for me. Okay, I want you to open your teeth. Okay, so I'm also going to be checking for your sensory. Okay, to just make sure you feel something on your body, on your face. So I'm gonna be checking with soft and sharp. So when you feel sharp, you let me know. When you feel soft, you let me know. Okay.
Sharp. Sharp.
No, I need to close your eyes. Okay.
Sharp. Soft. Soft. Sharp. 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 Soft. Soft.
Okay. I see that your sensory motor is that they are all intact. I need you to open your mouth wide. Any pain?
Nope.
Okay, good, awesome. I'm going to be checking your eye to just make sure everything is okay. Okay, with your eye, I'm gonna be flashing the light to your eye. Are you giving me the permission to do that?
Yes.
Okay. So look ahead. Okay. Can you open your eye? Okay. Okay. I want you to open your eye. Okay. I also want you to I want you to follow my hand. Don't move your head, just your eye, okay? Okay. All right. I also will be checking for the I need to open your mouth. Okay. So I have just done the cranial nerve check-in, the cranial nerve 3, 4, 5, 6, and which involved that the bilateral eyes, they all look equal with hair distribution normal. There's no lesion. There is no ptosis, no edema. There's no the conjunctiva is clear and injected. There's no conjunctivitis. The extraocular movement was pretty much intact bilaterally. The pupils were all equal, rounded, and reactive to light when I flashed the light to it. Also, there was normal convergence. Again, the left and the right fundoscopy exam I did revealed sharp disc margins and no hemorrhage. So I'm going to be doing visual acuity tests using the Snell chart. That is what's going to show the normalcy of the cranial nerve too. So Bessie, I'm going to be staying 20 feet away from you, and I want you to go ahead and identify the numbers. Now, closing one of your eyes.
ELTFPHOLCFDHJBS
Okay, so do the other one.
ELTFPHOLCFDHJBS
Okay, good. So I see 20/20 visual acuity, okay? So cranial nerve 2 is gone. So I'm gonna be checking your ear to just make sure everything is good, okay? So I need to check your size of your ear and also check the back of your ear. Just make sure everything is good and normal. Okay, the mastoid process is normal. So I'm going to be flashing this light and start to just look, okay? Okay. Okay, here. Great. Great. So I just checked the ear out now bilaterally. The ear canal is equal. The external ear is without inflammation. When I check inside, the tympanic membrane is pale gray, intact with positive light reflex. So another one I'm just gonna check again is the vestibulocochlear nerve, and this is to check for sound and balance. How hear you hear on sound, okay? So I'm gonna be making any way you hear the noise sound loud, you let me know, okay? Do you hear it loudest here or here?
Here.
Okay, cool. So I'm also going to check.
Yep. Yep.
Okay, that's it.
Yep.
So you still hear the vibration. Okay, so it shows that everything is normal, and right there you're okay with it. So I'm also going to check for, I just did the Rhine test and the Weber test. The first one I did was the Rhine test. The second one is Weber test. Now I'm going to be checking for your whisper test to just know how far you hear, okay? So I need you to turn around while I stay behind you and whisper something. Yeah, while I maintain a distance. So say whatever you hear me whisper, okay? Say it loud.
843Q.
Good.
KG34. KGV4.
Awesome. Okay. So I'm also going to be checking out your sinuses. Any way you feel pain, you let me know, okay? This is the frontal. Any pain? Any pain?
Nope.
This is the ethmoidal sinus. Any pain?
Nope.
And this is my right sinus. Any pain?
Nope.
Okay, so thank you so much for letting me do this thing with you. I also checking on your nose. It's symmetrical. There is no deviated nasal septum. When I palpated, there was no pain. And I'm also going to be checking inside your mouth and your buccal mucosa to make sure there is no wound and there's adequate. So could you open your mouth for me? The uvula is in the mid, no erythema, no visible tonsils. Your dental position is well aligned. Okay, can you show me your teeth? Okay, and neatly kept. Okay, so I'm gonna move into another thing. I'm gonna move in to check for other system. We just finished the one, so we're gonna go in now and check again for your cranial nerve 12 and cranial nerve 11 and cranial nerve 10. Okay, so I'm going to inspect the movement of your tongue. Can you open your mouth and stick your tongue out for me? Move it up and down. Okay, so everything looks intact. There's no deviation, there's no atrophy, there's no difficulty on the movement. Everything is all symmetrical. Okay? Alright. So I've already checked your gag reflex, which is your cranial nerve 9. When I stick the spatula in your throat, you were able to cough. Okay? So do this for me. Stick out your tongue. Okay, so say So I'm checking the glossopharyngeal and the vagus nerve, and that is the 10. They look intact. I'm looking at you. Do again. Okay, you're showing. Open your mouth and tilt your head back, Percy. Stick your tongue. Say Okay, good. I'm seeing the uvula in the midline. There is no problem. Okay, everything looks good. I'll also move on now to check your neck. Okay. So, I'm palpating. Any pain?
No.
Okay. I can feel your carotid pulses bilaterally. Okay. So I just checked her. I just checked her neck. There's no lymphoadenopathy. The infraclavicular part is fine. There's no thyroid goiter. There's no nodules. There's no issues. Okay. The jaw. There's no clicks. There's full range of motion. Do that for me. Okay. And move your neck. Okay. So we can look at and see everything. So let's move ahead and check your chest and your lungs and just make sure everything is good. Okay. I'm looking at you. Breathe in and out for me. Okay. Okay. The chest expansion is symmetrical. No difficulty breathing. She's not leaning forward to breathe. She's straight when she's breathing. Okay. There's no cyanosis. There's no jaundice. The skin of her chest are normal. There's no pallor. Okay. So let me check for normal expansion of the lungs through the back. Okay. Just to make sure she's expanding. Well, I need you to turn this way so I can have enough. Move your leg this way. Okay. So when I push, I want you to breathe in and out. Okay. Okay, so I'm squeezing. I placed my hand at the level of the 10th rib at the back, and she took a deep breath. Everything sounds normal, okay? All right, so I'm also going to listen to your breath sound. She has 3 lobes on the right side of the lung. So I'm gonna go from the upper lobe, take a deep breath. Vesicular sound, middle, lower lobe, and there's 2 lobes on the left side. Take a deep breath. Down, vesicular breath sound. I'm also going to listen to what we call tactile parameters. That's what shows for any consolidation, and it's going to, you're gonna say 99. When I touch you, you say 99.
99. 99. 99. 99. 99.
Okay, that all sound good. There is no problem. I also want to percuss your tap and make sure that your lung is doing okay. I need you to lay down for me. There's no dull sound. Tympanic. I need you to get up. No, I need you to lay. That's great. Okay. Some weight. Tympanic breath sound. Okay, I need to get up. Same. See, tympanic. Okay, so everything is tympanic breath sound to show your lung is in order. There's no problem with your lungs. So now we're gonna move to your, there's no tenderness. I have push. There's no issue on your ribs. So even at your, I'm gonna check what we call the costa vertebral angle, which is this side. So I'm gonna be pushing and just make sure there's no pain. Any pain?
No.
No tenderness. Okay, so I'm gonna be checking your heart, and that's your cardiovascular area. So what I'm gonna do is to listen to your heart and make sure that it's okay. There's no bruit, okay? But first of all, I'm gonna start from your neck down. I'm gonna feel the pulses. They're all present. I'm also going to feel the pulses here. Okay, they are strong and rebounding. Also move to your pedalis, the pedal pulses. Hold your leg up. Okay, and that. Okay, and then I'm going to be listening to your heart. Okay, so usually the point of maximum input is going to be at the mid-clavicular line at the 5th intercostal space. That's where we're gonna be listening, that's where I'm gonna be hurting. Okay? And then I'll also sculpt the house sound with my diaphragm to dictate aortic, pulmonic, herbs, point, and tricuspid mitral spots with my diaphragm. Okay, so let's do it. So I'm putting it here on your aortic. I move down to pulmonic. I also move to the herb, tricuspid, and the mitral. Okay, I hear S1 and S2 sound, regular rates, and no murmurs, no rubs, no gallops, no clicks, and no precordial movement. Okay, I'm also going to be checking your carotid too, using both the bell and the diaphragm. I just check there's no brood. There's no trail. Okay. So everything is normal, part of everything. I'm gonna be checking your abdominal air and aortic arteries to see what they're doing. To sound, I'm gonna use the bell. It's normal. We'll check the iliac. It's normal. And then I'm going to put this on your, I need you to help me do it. So put this, turn it this way, put it on your thigh where you have your joint here. Yeah, put it here. Okay. It's there. We also have to do it here too. No. Okay, cool. We good. So we get up. Okay. So everything looks good. There's no clubbing. All your pulses are palpable, bounding, and good. Also, I looked at your abdomen. There was no lesion. There was no rashes. There was no stripe. There was no hernia. There was no scars. Okay. So again, I'm going to be laying down again to listen to your bowel sound, which is required for this procedure. So I need you to lay on your back again. Okay. I'm going to be listening to the 4 quadrants. Okay, divide into 4. I go to the upper, positive bowel sound, lasting more than 20 seconds. Also listen here. Present. Present. I'm also going to be listening again to your renal arteries, which is 3 cm superior lateral of your umbilicals. It's around the second intercostal space. Right. So I just did that. I've also checked the femoral, so we're good to go. I'm also going to push. If you feel any form of pain, you let me know, okay?
No.
Any pain?
Nope.
Any pain?
Nope.
Any pain?
Nope.
Any pain?
Nope.
So I'm going to be palpating to feel your liver. I'm gonna go down, okay? About 2 cm down. Okay, so okay. Any pain?
Nope.
Okay, I feel your liver right here. Okay, so no spleen, it's palpable. The kidney, I'm going to be checking costovertebral tenderness. I need you to get up. I need you to turn your back this way. So I'm gonna be hitting the back. So this is the costovertebral space where the kidney is located. So I'm gonna be hitting it, okay? If there's any sound, you let me know. Any sound, any pain?
Nope.
No pain?
Nope.
Any pain?
No.
Okay, cool. So there is no tenderness. There is no tenderness, okay, on this. So we're gonna be moving to checking out another organ, okay? So we are going to be checking. I've already palpated the liver at the 3 cm towards the lower costal margin. And while she took a deep breath, I did that, and there was no problem. I pushed down, I felt the liver, but there was no pain, okay? I also palpated the kidney at the back, and then still there was no pain. So, so there was, we say there's absence of the Murphy sign. So the Murphy sign on percussion was negative for kidney tenderness, okay? I also palpated for the aortic pulse above the left umbilical area, and there was no trail, there was no brewing, okay? So I'm also going to be checking for the the I'm also going to be doing some assessment on the degree of movement of the muscles. So I'll start with checking on the what we call the arboretory sign, the arboretor sign, which is a discomfort felt by patient on their joints or at the movement of their hips. Okay, so the obturator internal muscle, will show when we move patient in a certain condition. So Bessie, I would like you to lay down. Okay, you lay down with your leg. No, I want you to get your leg in, yeah, to get inside. Okay, so I'm going to, if I move your leg, I'm gonna hold it. If you feel any pain, you let me know, okay? Okay. Any pain?
No.
Are you sure?
No pain.
Okay. So this is what we use to determine if a patient is having any problem with appendicitis or any issue with their internal organ, okay? So she said it's negative, so, and that's what it is. So we assume that's what she does not. So it's negative for that, okay? We're also going to be assessing what we call the psoas sign. The psoas sign is elicited by having the patient lie down on his left side. Best, I want you to lay on your left side. Okay, so this is what also determines if there is pain going on in the internal muscle that is connected to the digestive system. So Bessie, I need you to move your leg. So just relax this. So I'm going to move this. No, lay on your left side. Okay, just like that. Okay. So if you feel any pain, you let me know. Any pain?
No.
Are you sure?
No.
Okay. Another way that we can also do it, lay on your back. So I'm going to want you to raise your leg up. Push against me. Any pain?
No.
Okay. Is something? Any pain?
No.
Okay. So the psoas sign is also negative, showing that there is no issue going on with the muscle that is connected to her digestive system. Okay? So the psoas sign is negative. Okay? So now we're going to be moving to palpating the aorta. The aortic pulse is palpated above the left of the umbilicus, and then when we do that, we use it with our index finger also to note if patient, with my two hands, I'm gonna be palpating that, and just make sure there's no pain. If you feel any pain, you let me know, okay? Any pain? Any pain? So the aorta, the aortic pulse, palpated up here, and I feel it. It's going down. See? Good. Boop, boop. So that's it. So we are good with this one. So we're done with your chest, your thoracic cavity and abdominal cavity. So now we're gonna move on to the neurological. We're gonna do to neurological assessment, and that is it involves you showing me that everything is intact with you. So let's do this. Move your hand and touch your nose. Again. Okay, finger to nose. Okay. So I want you to have alternate movement with your hand. Okay. I want you to also use your leg to touch your shin area. Do then alternative. Okay, cool. I also want you to get up. Okay? do the same thing. Do alternate movement. Okay. Touch your shin with your leg. I also want you to close your eyes and put your hand out. No, like this. To get my resistance. Push against me. Okay. Okay. I want you to walk from here to here. Also walk to here. This is where the camera can see you. Okay. The gait is steady. There is no staggering. There is no issue. I also want you to walk on your heels. Can she walk on her? Can you get her on the camera if she walks on her heel this way? Okay. And walk on your toes. Okay, cool. She walking on her. Walk on your toes so that the camera can get you. Okay. I also want you to also walk heel to toe. What we call the tandem walking is this. Watch me. So I want you to do that. Okay. Can you get her feet while she doing it? Mm-hmm. Okay, do it backward. Okay, but your leg will have to touch your heel. Okay, all right, is there. I know you're a little bit tired because it's already late. I also want to make sure there is no pain in any of your extremities, okay? So let me touch everywhere. Any pain? Any pain? Any pain with your hand? Can you squeeze my hand for me? Squeeze again? Okay, all right. Any pain?
No.
Any pain?
No.
Okay, so I'm gonna do what we call the vibration using the tuning fork. I just wanna make sure that all your sensations are all in order. So how do I do it? I'm gonna use this, move a little bit inside. So I'm gonna get some sensation. So you let me know when it stops, okay?
It stopped.
Okay, cool.
It stopped.
Good.
It stopped. It stopped. It stopped.
Are you getting us on the video what I'm doing? Okay.
It stopped.
Cool beans. Okay. So it's intact, okay? So I checked I'm gonna also check the malleolus. Sorry, the back. When it stops, you let me know.
It stopped.
Good.
It stopped.
Good. All right. So you are just intact. Everything is good. So I'm just gonna do what we call the deep tenor reflexes. It's going to show how you respond to sensation when it's done. So I'm gonna start with the one for the biceps. Okay. So I'm gonna hold it and just. Okay, see the jacking movement? You just did it. So do it on both hands. There's a twitch when I did that. Okay? If I can have a look at it. No, I need to get this. Move it down, move it up. Yep. Okay. And then I'm also going to do that of the brachialis, whereby no, that of the bicep, okay, the deep tenor of the bicep. So we're gonna do where I'm going to do that. So I'm going to Okay, see a little reflexes here. So just relax your hand. Okay, okay, all right, this there. I'm also going to do the one at the patella, which is on your leg, on your knee, okay? So, you do that. So, I want you to extend your leg for me so I can feel your tendon. Okay, so I'm just gonna go. Okay? Okay, it's there. I'm so excited doing this. Okay? Alright, and then we're also going to do the one at the back of your feet. Okay? There, positive. Okay, so, and then I'm going to check how you can respond to what we call the Babinski sign. It's usually a sign to show that you are well developed on the neuron on your leg on how you respond. So lay down and then leave your leg like that. Okay. Okay. Okay, so there's hyperextension. Okay, that's it. That's all I wanted to get. Okay, get up, give me your hand. I also going to be checking how well your musculoskeletal system work. So now we're gonna be checking your strength and your range of movement. So let's start with your strength. Give me a grip. Pull me. As I'm pull. Okay. All right. Now pull your hand against me. Pull. Okay. Cool. See, very hard. Okay. So I also want you to lift your hand out. Now pull against me. When I try to push you down. Okay. So do the same again. Okay. All right. The same thing with you. I need you to move back. Move back. So push against me. Down. Okay. Cool. There. All right. So, and then also, I want you to give me a rhythmic movement. Move your neck. Awesome. Move your hand, your shoulder. Come down. Move your hips. Rotate it. Okay. And then your hands and your fingers. Move it. How about your knee? Can you bend down a little bit on your knee? Cool. All right. Move your ankles too. And your feet too. Wiggle it. Okay. Equal strength. So we're going to check that we've checked all this stuff and there is no loss. Good muscle tone. Everything in the right places. Strength in both upper and lower. Then we're also going to check your spine alignment to just make sure that you're doing well. So let's do this. Get up. I want you to bend down like you want to touch your toe. Okay. All right. Then get up again. Repeat it again. Okay. And then get up again. So I'm going to be performing what we call make more movement. So whereby I'm gonna hold your leg and knee, and I want to rotate in and out. Okay, so you lay down. Okay, so I need you to get up. I need you to flex it now and back. I need you also to move it in and out. So do that on your own. Good. Now do the other one too. Okay, so I'm also going to perform the varus, where I'll hold your leg, okay, and then I grab it by the knee, and then I move it, okay. So I don't want your hip to move. I just want to mobilize it and then move it on my own. Okay, it's there. All right, and then I'm gonna do the same thing on this one. I don't want to block the camera. Just gonna do this and then I'll move it. Okay, so the thing is there. I'll also be going to do check for the last thing that is remaining that I'm gonna do. So the last thing that I will be doing is to check on the what is remaining. I'm going to be checking on the other test that is required for this, and that other test that I'm gonna be doing is to perform anterior drawer exam, and that anterior drawer exam required that you flex your knee at 45 degrees angle while I sit on your foot and grab your knee. Okay, so now you lay down. Okay, so with this one, yeah, this is gonna be a little bit hard, but no. Sit on your knee.
Like this?
Yeah, while I sit on it, and then I grab your knee, and then I pull. Okay, so let me do this other one. It's called, I'm performing the drawer exam. Okay, so I do is jacking. Any pain?
Nope.
Okay, so there is also no anterior ligamentous. So I'm gonna perform another one they call the Apley scratch test. So the Apley scratch test is whereby you come in, and then you stand up. Okay, put your hand on your back like this, and this one, and grab your hand. Grab your hand. Okay, you're there. So do it alternatively. You do the other hand. Okay, and do the other one. Okay, all right. So at least it wasn't symmetrical. You got the other one, but the other one. So we're gonna do another one we call the empty can extend hand test, and that one is the one we do whereby I'm gonna grab your hand. Okay, so now when I feel some resistance, when I try to do it this way, okay, so if I apply, give me some resistance. Okay, wow, it's there. Any pain?
Nope.
Okay, let's do it again. This one. Try, pull, resistance. Okay, so that one looks good. There is no issue on those ones. So we're gonna do another one we call the Fanley test. The Fanley test is what shows if you have a carpal tunnel syndrome. Carpal tunnel syndrome is usually the sensation pain people have sometimes. So I want you to put your hand together and put a pressure on it. Let's hold it for 30 seconds. Okay, any pain?
Nope.
Are you sure?
Yes.
Good. So another one we're gonna do is what we call the drop arm test. The drop arm test indicates, put your hand all over to your head. No, get your hand as far you can go. Now, make it at 90 degrees. Put it at 90 degrees. Hold it for 20 seconds. Good. It shows your rotation curve is in order. There's no tearing of the rotation curve. It's perfect. So we're gonna do another one we call the apprehensive test. Okay, this apprehensive test is for glenohumeral joint stability. So I'm going to grab your scapula, and then raise your hand up. Raise your hand up. So let me follow. Okay. Any problem?
No.
Are you sure? Okay, so I'm gonna do the same way on this one. I grab it. Okay, so you are negative for that. So it shows that your joint stability is in order. So another one that we're gonna do is the Tinel test. The Tinel test is the tapping of the anterior aspect of your wrist. If it shows pain, that's why if there's pain, you let me know, okay?
No pain. No pain.
Are you sure?
No pain.
All right, so we have come to the end of this assessment, and it's my pleasure that I'm able to perform it with you, Bessie, and I'm so appreciative for your support, for being here, and for approving to be a part of this course. And I'm looking forward to the feedback, and I appreciate it. Thank you so much for your audience.